Hello, I'm Emily Worley, and I'm currently a third-year medical student at the University of Kansas School of Medicine. And the research project that I will be presenting today is focused on assessing the efficacy of medical education on adequately caring for our population with developmental disabilities. So just to provide some background, I created this project in conjunction with KU's Department of Developmental Pediatrics because we continue to see disparities in health outcomes for those with developmental disabilities. These disparities range anywhere from things as simple as delayed time to diagnosis of common health problems to those as serious as increased morbidity and mortality during hospital stays. And while we have the data that clearly displays that these disparities exist, there's not very much information out there on why. One hypothesis that has been proposed is that we as providers don't get the experience and training during medical school to effectively provide care to this population. So I decided to design a project that would provide an assessment of the efficacy of medical education on those care competencies required to provide those with developmental disabilities effective care. So I ended up creating an online cross-sectional questionnaire that was modeled after an article composed by the Alliance for Disability in Healthcare Education that contained 6 core competencies deemed necessary to provide quality interprofessional health care to patients with disabilities. This questionnaire contained both qualitative and quantitative questions that focused on assessing student knowledge and preparedness to care for those with disabilities and was distributed to our first, second, third, and fourth years medical students that were enrolled at the University of Kansas School of Medicine during the 2018-2019 academic year. And it was sent out at the end of the year in May, so just something to keep in mind. My hypothesis was that as it currently stands, our medical education lacks holistic training required to effectively care for those with disabilities, and by extension is part of the reason we are seeing these disparities in health outcomes for this population. So after compiling and analyzing the results, there were a couple of things that really stood out to me and that I wanted to highlight here. First, when asked to rate self-confidence and ability to care for those with disabilities, I expected to see our first and second years rating themselves lower than third and fourth years purely due to less years of experience. However, what we saw was that our graduating fourth years rated their confidence of caring for those with disabilities at 54%, the exact same as our entering class of first years. This was pretty shocking to me because these are students we are graduating from medical school saying that we're confident in their ability to care for patients, while the students themselves were less than confident in their own ability. And apart from self-perceptions, the results ultimately showed that in each of the 6 categories that were assessed, not one received above a 65% pass rate, with the lowest being contextual and conceptual frameworks at 43%, and the highest being teams and system-based practices at 65%. Ultimately, these results suggest that we have work to do, not only in basic knowledge and background, but in hands-on experience with those with disabilities during medical training. So in conclusion, the results from this project provide a tangible area to focus future directives on in order to improve healthcare for those with developmental disabilities, which is imperative particularly to this population who so intimately depends on this service. And finally, to wrap everything up, I wanted to discuss some future directives that are already in the works at the University of Kansas School of Medicine. First, inform of the results of this project an educational film meant for use as a resource in gaining knowledge on present gaps in disability healthcare education was created in conjunction with our Center for Developmental Disabilities. Additionally, the Center for Child Health and Development at the Medical Center secured a grant that provides funding for the development of an educational lecture series focused on developmental disabilities support in healthcare and curriculum. This series is currently being developed and distributed to our current medical students here at KU. And then finally, I just wanted to end by thanking just a couple populations that really helped me with this project, and I couldn't have done it without them. First, from the Kansas Pediatric Center for Child Health and Development, Dr. Catherine Ellerbeck was one of my major mentors and really collaborated with me in the creation of this project. And then Dr. Jessica Shetler, as well as from the University of Kansas Center on Developmental Disabilities Consumer Advisory Panel. Those 2 populations were really just instrumental in helping create the educational film that I mentioned. And our Consumer Advisory Panel is just a group of people that are self-advocates and have developmental disabilities themselves, and then are just support systems for those people, and they're just an incredible group of people. And then finally, from the University of Kansas Department of History and Philosophy of Medicine, I actually received a summer fellowship, the Clendening Summer Fellowship, that provided funding for this research. That was incredibly helpful. So So I just wanted to thank those specific populations for this project. And that's all. Thank you.
Great. Well, thank you, Emily, for presenting that project. I think it's really interesting, the work that you've done. I'm interested to know a little bit more about the kinds of questions that were on your survey. So what were people asked in those 6 categories?
Yeah, sure, absolutely. So our 6 categories, which let me see if I can go back on my presentation here, were specifically, so like I mentioned, the contextual frameworks on disabilities. So that category basically consisted of just kind of your basic background knowledge on the different types of, especially our common disabilities, developmental and otherwise. And so things like Down syndrome and cerebral palsy, a lot of different of those categories. It was just kind of the actual background and knowledge of those different diseases and kind of the medical side of treating them. Our second category was the professionalism and patient-centered care. So for that category, it was really, I mean, that was a category that can apply to any patients, not just those with disabilities. And it was really just focused on, you know, how can we provide professional care, especially to those with disabilities, because sometimes, especially, you know, with my conversations from talking to individuals that have had bad experiences in healthcare, sometimes for those with disabilities, we kind of assume that maybe the caregiver with them in the room is, you know, should be our first source of information and things like that. And so how, you know, just our students being professional and actually addressing the patient themselves first. For legal obligations and responsibilities for caring for patients with disabilities, that was just, you know, what policies are out there that are actually already focused on advocating for those with disabilities, and what can we utilize in healthcare. Next category was teams and system-based practice. So again, a category that can really be a part of, you know, any patient population, and that's just, you know, how well are we utilizing all of our different avenues of healthcare and all of our different teams in the healthcare system. The clinical assessment was that just, you know, kind of the physical exam part of that is specific to caring for those with disabilities, and so more of kind of just your background knowledge, and are you able to actually perform the correct tasks in what we need to be doing for caring with those with disabilities. And then finally, the last category was clinical care over the lifespan and during transitions. And so that was really just kind of focused on, I guess, kind of to provide a little more background, we found that our pediatricians are actually, you know, the most well-equipped to deal with those with disabilities, because a lot of them are diagnosed in childhood. And so how well are we at actually transitioning that care from a pediatrician who gets to know that population so well and so intimately into the adult population, where there's just not as much support for things like that.
Do you think that, so it sounds like a lot of your questions were knowledge-based. Do you actually know what the law is, for example? It sounds like you might have also had some questions, though, about kind of how do you feel about taking care of this population, or sort of your own self-efficacy of how comfortable you feel with it. Do you think that the challenges of caring for this population made people say, I'm not ready, I'm not as comfortable with this as maybe it would have been if there was another condition that you looked at?
Oh, absolutely. I definitely think that was probably a big part of it, because I actually, kind of like you said, I had, you know, those, I guess, preface questions before we even went into just the knowledge and background of just, you know, what experience have you had with an individual with a disability, and then how confident are you? And so what we found was, you know, the people who were most confident, who actually, you know, showed any confidence at all, to be frank, were people who had prior experience working with those with disabilities. And the other thing I will say is that we kind of wanted to tease out where, you know, people were getting this experience with those with disabilities, and a lot of it was from, you know, a family member that had a disability, or I worked with someone in high school that had a disability. A very little of it actually came from an interaction during medical school. So that was kind of another thing we saw, was it's exposure is a big issue as well.
Right. And it sounds like, I mean, it sounds like there's a lot of work being done to sort of highlight the problem, which is great and certainly needed, and then build in these lectures into the medical education curriculum. Do you think that there's a place where you'll be able to build in, or the school will be able to build in, some real world experience of actually working with patients, so that it's not just all the theoretical lecture, but that students will actually kind of get in the trenches with the patients and get to see some of these folks?
Yes, very, you know, that's actually something that we're trying to focus on, because, you know, that that real world experience is just so vital, especially with this population. And so working with I'm actually, working currently with our Center for Developmental Disabilities on what that is going to look like, because, it's not a lot of times in our clinicals and the time where medical students are actually out in the hospital environment, it's, what patients come in, you're kind of stuck with who your patient population is. And so that's kind of the challenge that I guess we're dealing with, is how do we ensure that we are getting that exposure during medical education just by, getting to see our general population, because every single specialty is going to see someone with a disability. That's why it's so important. So kind of, I think, I guess to go back to answering your question, I almost feel as if it needs to kind of be part of just each rotation, like if you have a patient that has a disability, really focus on giving students that experience, rather than sometimes, and in my own experience, so this is a very personal experience, but sometimes providers shy away from allowing students in some of those rooms just because it can, for especially some different disabilities, it can be very overwhelming for that patient. And so looking for ways where we can still include students in that learning experience, rather than just kind of saying, oh, this isn't going to be one you're going to get to go in and see.
Sure. Great. I mean, I would definitely encourage you to, if you stay engaged with this project, think about repeating your assessment in a few years. It would be fascinating to know if, as the curriculum changes and all of these things get built in, do we see people improving their scores, or do we still see people kind of at the same place, and sort of just dive into that a little bit and see what we might find a few years from now. Because I think this is a really important project. I think it's a really, you've highlighted some of the real challenges of how do we get students this experience, because it's not as though we want to say, oh, we have a patient with a disability, let's have all 12 students on the clerkship come see them, right? But at the same time, we don't want it to be the patient that we say, oh, this isn't a student patient, let's get to see somebody else. We want to make sure people are having that chance. And so I think that's great. I think you've done a really nice job. Nice job with this project.
Thank you very much. I really enjoyed it. It's definitely something that I think needs to be more forefront of some of our things that we're focusing on, I guess I'll say, in our curriculum. So it's a really, really fun project to do.
Great.
Well, good. Well, thank you so much for both of you giving of your time today to give this poster presentation, and as well as to participate in the learning process. This is our final poster presentation in our 2020 student poster presentation series. So thank you both so much for your time today.
Thank you. Thanks so much.